child unresponsive. What would you do? Simply knowing CPR could save a loved one's life. I'm in the nursing field and I'm required to renew my CPR and my first aid license every 2 years. And this can relate to you guys because at any point in time someone could go unresponsive and you could be the one person there to help them. First, I'm going to tell you a little bit about the history of cardiopulmonary resuscitation, the steps, and some helpful hints to remember. First, we'll go to the background. CPR actually didn't originate from America. It was found in 1740. The Paris Academy of Sciences officially recommended mouth-to-mouth resuscitation for drowning victims. In 1981, Dr. Frederick Mass performed the first documented chest compressions. 160 years later, Dr. George Craik reported the first successful use of chest compressions. In 1957, the United States military adopted mouth-to-mouth resuscitation method to revive unresponsive victims. Over all these years of studying has made it easy for me to explain to you in just a couple of minutes. It's not a hard skill to learn, but it's easy to forget under pressure when everything is going crazy. So the first thing is you want to shake and shout at your patient. So you'll grab your patient or the victim by their shoulders and shake them and say, "Hey, are you okay?" The next is to check for a pulse, which you'll put 2 fingers right here. This should take less than 5 seconds. Whenever you're in this situation, this person is technically not alive. So the more time you take, the less likely it'll be to revive them. Next, you'll want to call for help. If you have somebody there with you, assign them, "Hey, you call for help," and then that way you can start with CPR. So the first thing you want to do is tilt your patient's head up so that you can make sure there's nothing in their airway. Next, you'll want to do proper hand placement, which is in between the nipples, right below for adults, which you can see here. It's just slightly below on the breastbone. For children, it's right in between the nipples with just 2 fingers. So some people will do it this way. The only problem I find with that is you're pushing into the patient. So I do it this way. You'll want to remember to do 30 compressions, and then when you stop for 2 seconds, you can either do mouth-to-mouth, which will give them oxygen, but if it's not somebody you know, obviously we're all, more likely not to do that. So they've actually, in 2008, they said that you don't have to do that anymore, that if you just do CPR, you're still getting oxygen into the body and circulating it. You want to push hard and fast, and your goal is 100 compressions in a minute. Now for an adult, you want to go 2 inches down, or for a baby, it's 1/3 of the baby. Now some people will pick up the baby as well, and they can use 2 fingers this way. However, again, I feel like if you're a bigger person, your hands might squish the baby and you're not getting the proper oxygen. So for me, I always use 2 fingers. A tip to remember is anything can help. Technically, that patient is not alive and not breathing. So if you're doing it correctly, you will probably break ribs, and that scares a lot of people into doing it. But as my teacher once told me before, they're technically dead. Anything you can do can help. Every second matters, and you don't want to waste any time. You want to start CPR as soon as possible and don't stop until help arrives. If you have somebody else with you, it's also great